contraception. And let me invite Dr. Sophia Yen so she can join us and give us a little talk about birth control contraception and the many benefits beyond birth control. Let me just invite our co-founder and chief medical officer, Sophia Yen. Right, so for those of you today, our little topic is called birth control beyond contraception because if you didn't know, there's many uses for birth control besides prevention from pregnancy. So the topics covered today will be such as PCOS. It's very beneficial for people with PCOS, endometriosis, and also coverages such as like acne. It also can really help with hormonal changes. Now, before Dr. Sophia Yen gets on, I'll tell a little story about my journey with birth control and how I found out that it's used for much, much more than birth control. Oh, hi, Dr. Sophia Yen. I was just giving our viewers a little snippet of our topic today, which is birth control beyond contraception. What are the many benefits besides just contraception, you know? And I was giving them a little rundown of how it could benefit you with PCOS, endometriosis, acne, hormonal regulation. So first, before we get into all that, did you want to give a brief rundown of what birth control is usually meant for, which is contraception? So how does the birth control pill, patch, or ring help with contraception?
So the birth control pill is one of the top methods of preventing unplanned pregnancy. And one could say that its failure rate ranges from 2 to 7%, depending on perfect use versus standard use. And the problem with the standard use is people forget to take the pill every single day. And when we talk about birth control, we're generally talking about combined hormonal contraception. So that means it has both estrogen and progesterone. And we're talking about the pill, the patch, and the ring, not the hormonal IUD, the implant, the shot, because those are progesterone only methods. But all of these methods do have benefits and different side effects.
Right. Awesome. Yeah. So how does the hormonal birth control pill or hormonal birth control differ from non-hormonal birth control? Like, how does that help with contraception?
Yes. So the non-hormonal methods are, fertility awareness. So don't have sex on the days that you are fertile. But the problem with that is that most women's cycles aren't regular, and that almost every person with a uterus's cycle is influenced by stress. And so you may have personally experienced this when you're really stressed out. Hey, Candace, good to see you. And see that your periods get pushed out farther when you are stressed out. And so if you don't have a regular schedule, then using a fertility awareness method or using the apps isn't so great out there. If you combine it with temperature and combine it with studying your cervical mucus, and that gets better. But even then, it's, I think, like a 20% failure rate. So 1 in 5 people using those methods will get pregnant in a year, versus a 7 or 2% failure rate with the birth control pill, patch, or ring. The way that the pill, patch, or ring works is that the estrogen and progesterone tells your body, oh, she's pregnant, so you don't need to pop out an egg. And then the progesterone also thins the lining of your uterus so that if the egg and sperm were to hook up, it couldn't stick to the side. And then the progesterone also causes a thick cervical mucus plug. So you have your uterus, and then you have your cervix at the bottom of the uterus, and then you have your vagina. And the cervix usually has a mucus plug there, and only when the egg pops out, it opens it up and it says, hey, sperm, run up here, run up here. But if you cause a thick mucus plug, then it's pretty much like doors closed. No sperm should be able to get up there. And the only time that sperm can get up there is when you drop the mucus plug, when the progesterone drops and you have your period. So having sex right after your period is probably the riskiest part. But before that, there should be a strong cervical mucus plug.
I see. Good to know. Okay, awesome. So let's move on besides what birth control is good for beyond contraception. Now, let's start with something like PCOS. How can taking birth control help with PCOS? And can you give us a little brief rundown about what PCOS is?
Yes. So I see Candice Darian here, who has a tea that helps PCOS people. And she also believes in the 3 C's, which she can drop in the comments, which is about exercise, eating clean, and being consistent, and some other things as well. Sorry, I can't remember all of them. But polycystic ovarian syndrome is usually diagnosed if you have irregular periods, haven't had a period for 3 months in a row, and then if you have signs of high testosterone. And signs of high testosterone could just be a blood test, could be free or total testosterone, but could also be zits in places, more zits than usual, zits in places where most people don't get zits, like chest and back, hairy upper lip, hairy escutcheon, as we call it, heading up towards your belly button. Some people call that the triangle of something or other. So those are kind of signs. And then certainly if you get an ultrasound, seeing a whole bunch of cysts on your ovaries. And what happens in polycystic ovarian syndrome is that these every single month, normally for anybody who has ovaries and uteruses and is not on any hormone treatment or whatever, every month, like 3 to 5 eggs try to grow. And whoever gets the most estrogen pops out. And the one that pops out can then become a future embryo in the future. However, in polycystic ovarian syndrome, there's an imbalance of the male female hormones trending more towards male hormones with the testosterone. So the egg doesn't pop out. And so these cysts keep building up in your ovary. And so if you look at it with the ultrasound, it looks like a string of pearls. And so that is the polycystic ovaries that you'll see on an ultrasound.
Right, right. Yeah, thank you so much for that breakdown. Now, that sounds like a whole slew of problems, right? So does birth control help with those symptoms such as like acne or hairiness or like the irregularity of the
Yes.
periods?
So it's mainly the estrogen that's in the estrogen progesterone containing birth control options. Again, the pill, the patch, the ring, that increases a thing called sex hormone binding globulin. And sex hormone binding globulin sticks to the testosterone. So there's less free testosterone running around in your body, causing these male side effects of zits and balding and hairiness. So it's mainly the estrogen. However, there are 8 different progesterones, not all in one pill, but each different pill has a different one. And some of them are known to have more androgenic side effects. Again, the zits, the munchies, the weight gain, the hair loss, bad cholesterol. And then some of them have lower androgenicity. And given that I'm an academic physician, given that we wanted to minimize the side effects in women, I took all 40 different birth control pills, plus rank them from most likely to give you zits, least likely to give you zits, most likely to give you munchies, least likely to give you munchies, most likely to give you breakthrough bleeding, least likely to give you breakthrough bleeding, and trained we have 100% physician team at Pandia Health
Wow.
on how to choose the best birth control for you on the get-go. So you don't have to try 3 different pills to find the good one for you based on your age, BMI, race as a proxy for genetics. And in the future, we're currently asking patients if you have genetic sex, some people have 23andMe, DNA ancestry, to give us your genetics so then we can help improve the algorithm. So in the future, we'll be like, oh, you have these 3 genes, then the woman who had these 3 genes like you did well on this pill, so why don't you try this pill?
Yeah, that's so good. Segue a bit out of this. We'll come back to this topic, but you mentioned the research and how that's going to help the Pandia Health algorithm. That's so great. I feel like that's so groundbreaking. Can you talk a little bit more about it and inform our viewers what type of scientific research you're doing?
So as I mentioned, right now we just have an algorithm based on about 4 variables plus your personal health history. But if you give us all of your genes, then we can search all the genes and we can throw it into a machine learning model where the AI just looks and figures out, oh, whenever you see this pattern, then this is the suggested birth control situation. And because our customers, for the majority, we just added menopause, but most of our customers are birth control. For the past 8 years, we have data on 40,000 patients that are just birth control. And because I'm an academic physician, then I'm obviously interested in research, which is different from a company that's founded and led by an MBA per se, or a physician who's not in academia, is not used to writing research or doing research.
Right. That sounds so amazing. I can't wait to see how that will improve Pandia Health's algorithm and take a lead for women's health in general. It's great. Okay, are there any other diseases or bodily illnesses that can be managed by birth control?
Yes, so 70% of women that are on birth control, pill, patch, ring, are on it for other reasons in addition to preventing unplanned pregnancy. And so the number one cause of anemia in a menstruating woman is menstruation. And if you go on the pill, patch, ring, it decreases your blood loss. Usually, I don't think I have a quantifiable number, but the example I gave is if you usually bleed 7 days, it takes it down to 5 or even 3. And then if you usually bleed and use 5 maxi pads or tampons a day, then it takes it down to 3. And so, a 40% reduction in blood loss with the birth control pill, patch, ring. And great to see other people joining our live. Thank you so much. Feel free to drop any questions you have. So number one is anemia. So if we decrease the amount of blood, then you're going to have a lower risk of anemia, and it's a way to treat anemia as well. But I also like #periods optional. So know that if you're on the pill, patch, ring, you don't need to bleed every single month. That's purely arbitrary. That 1 week that you decide to bleed, you could do it every 12 weeks. You could do it every 6 months. I personally did not bleed for the past 14 years, my last kid, because I was like, if I'm not trying to make a baby, why am I bothering to grow the lining and slough it and grow the lining and slough it? So, and every time you grow the lining and slough it, you risk cancer, because when you grow, you can have uncontrolled growth, and that's endometrial cancer. And then every time you pop out an egg, the popping or the healing, we don't know if it's that, or the tube, by being on the birth control pill, patch, or ring, because it blocks the eggs from popping out every single month. For 5 years, you decrease your risk of ovarian cancer by 50%.
Oh, wow. That's so crazy. I know that you explained it a little bit, but it's because of the shedding and the lining of the uterus, right? And that prevents ovarian cancer. Can you go into a bit more detail with that?
Yeah, so the more times you pop an egg, and we don't know if it's the popping, the healing, or something to do with the tube, then you have an increased risk of ovarian cancer. And so on the birth control pill, patch, ring, with estrogen and progesterone, what it's doing is stopping ovulation. So no popping, no risk of ovarian cancer. And so the research has shown, if you can quiz your physician to check if they know their stuff, how do I decrease my risk of ovarian cancer? Not taking out the ovaries. And if they don't know that going on the birth control pill, patch, ring for 5 years decreases it by 50%, then they may not have been keeping up with the latest literature.
Yeah, I know, no shade to my doctor or anything, but he's a male doctor, and he didn't know that. So that was a fun fact for him to learn. So glad that I could educate him.
Yes, I love it.
All right, we have a question from Candace. She asked, is it safe to stop the period?
Yes. So if you're on hormonal therapy, yes. So anybody who has been counseled before they get the hormonal IUD, the implant, or the shot for birth control methods, 30% of people that go on the implant or the hormonal IUD, the normal strength, the lower strength bleeds every month, but the normal strength hormonal IUD, 30% have no periods, and that's perfectly fine on those methods. And then, as I mentioned, with the pill or the ring, you can not bleed for 14 years and it'd be totally fine. You could not bleed the entire time you're taking it. And the key there is to realize that it's actually not natural to bleed as often as we currently are bleeding. And so if you go to, I'm going to drop it in the comments, but pandiahealth.com/periods optional, at the bottom is my TEDx talk on the science and safety of not having to bleed every single month on the pill or the ring or the IUD or the implant or the shot. With the shot, after 3 shots, 75% of people have no periods. And what I like about the pill, the negative is you have to remember to take it every single day. And so the odds of you messing up, you have 365 chances to mess up a year on that. Though really, it only matters if you miss it 2 or 3 days in a row. But as I was saying, what I like about the benefit of the pill is that there's 40 different pills. So if one doesn't work for you, I know there's at least 7 other progesterones and theoretically 40 different pills because there's 2 different doses of progesterone as well. So pretty sure I can find one that works for you.
Yeah, I know. There's gotta be one out of all those options. Okay, now correct me if I'm wrong, and then you can also answer it in more detailed answer after this, but everyone, I think, is aware of skipping your period on birth control pills. And I believe you do this by skipping the placebo pills, right? Yeah. Is that correct? And how exactly do you do it? Let's step by step walk our viewers through it.
Yes. So I'm getting out my handy dandy pack of pills, and my stand is creatively, artistically slanted. But anyway, so you see your pack of pills. Normally these 3 are one color, or they're 3 different colors, but we generally do not recommend the 3 different color. That's a triphasic pill. If your doctor's prescribing a triphasic, that is not an academic physician, because we know that it's better to have smooth hormones rather than up and down, up and down, up and down every month. Okay. So you take 3 weeks and then you just jump right into your next pack of pills. Just start it. So you see, I have all these pack of pills where the last week is not taken because I jumped straight from here into the next pack. If you do take these pills, these are usually sugar pills. They sometimes have estrogen. They sometimes have iron in them. The iron is to replace the blood loss. But if you don't lose blood, you don't need the iron. It's also to make you remember to take a pill every day, because if you forget, then you end up pregnant. So if you do it right, your packs will look like this, and you will just go straight into the next one. The other tip is, often it just depends. Different people are different. It depends how strong your hormones are. It also depends if your roommates are like contaging you with their periods. When my daughters got their periods, I was like, you stay away. Do not infect me with your periods. Because I had roomed with 2 25-year-olds, and they're like, hee hee hee, I got my period. And then hee hee, I got my period. And then I got my period. And I'm like, I'm a doctor and I'm taking these pills and I know how to take the pills. Why am I bleeding? Because they infected me with their hormones. And so if you spend 8 hours a day in close quarters with someone, and I've seen 2 women that work together infect each other, and I've seen it, and people sync up. Though the research says you don't sync up, but I think they didn't do the research right. Anyway.
Yeah, I heard that. It's like myth or fact. You sync up with the person, but I can be a guinea pig with that test trial. Like, I swear I don't get my period, don't get my period. But as soon as I'm with someone that has their period, I get my period. And it's not like that's just happened once. It's happened since I've had my period. Yes. So they need to research that better.
Yes, I actually think that it's a new fertility treatment. There are some women that I call crazy fertile, and those are the ones who have a period every 28 days. And so if you're having difficulty conceiving, you want to hang with the every 28-day girl, or go be the house mom for a sorority, because there's a lot of women there and a lot of them are cycling, so they will definitely infect you.
Right. Quick tip. All right. Besides all that, can birth control help with acne? Yes or no?
So if you have 100 people on the birth control pill, 100 people not on the birth control pill, the people on the birth control pill will, in general, overall, on average, have better skin. But as I mentioned, there are 8 different progesterones, some that are more likely to give you munchies and zits than others. And so if you notice that you start a pill and your acne gets worse, I would give it a month or 2, because sometimes it's just getting used to the pill that you're on. And if after about 8 weeks, you're like, this is gross, then talk to your doctor and get on a different pill. But generally, when you come to Pandia Health, we're trying to minimize acne, minimize breakthrough bleeding. And we just looked at our research, and our numbers are so much lower than standard. Standard is usually like 10% of people have acne, 10% of people have breakthrough bleeding. We saw that about 4 to 5% of our patients had acne, and like very low 2% had breakthrough bleeding.
Right. And I also believe that we have an 80% retention rate for the first year, right? So what that means is that I believe the statistic for other companies or brands and stuff, I think it's around 50%, if I'm not correct.
30 is kind of standard, and then with delivery, we see 50, 55, and so we take it up to 80, 82.
Yes, so we have 80. So that's how you know, like Dr. Sophia Yen's research and the work here we do at Pandia, it really matters because 80% of people are very happy with their first batch of birth control. And there's so many negative or horror stories about birth control, like, oh my God, I made me gain weight, or I made me this or that. But 80% love their birth control on first try. And I think that's an accomplishment.
Yes.
I also had another question previous to earlier, had this in my mind. A common myth that Pandia has to bust is that you need your period to get rid of all the bad stuff and the gunk in your body. And that's why it's healthy to have a period. This is definitely a myth because having a period on birth control pills is different than a period without being on birth control, right? Can you explain that, the difference between a withdrawal bleed and then?
Yeah, so exactly. When you bleed on the birth control pill, it's a withdrawal bleed. And so I'm going to get my pack of pills again. So when you're on this week, these are sugar pills, placeholder pills, sometimes have iron, sometimes have a little bit of estrogen, but it's the drop in progesterone that triggers the shedding of the lining of your uterus. And when you're on the pill, it knows you're not trying to get pregnant. And so without the birth control pill patch or ring, imagine your uterus filling up with enough blood and thickness to a level 10 so that if an embryo happens, it can stick and it can grow for 9 months. But when you're on this, the lining only gets up to like a level 1 or 2. And so you can like decide to drop the progesterone and clean it out every 3 months, every 6 months, once a year, but there are no toxins building up there. The thing with PCOS is when they are not on any hormones, then the lining grows, and you have risk of endometrial cancer. But if you're on the birth control pill, patch, ring, or the progesterone only methods, it thins the lining. So that's part of the way it works, is if an embryo were to happen, it can't stick because it's so thin, it can't grow anything for the 9 months that it needs to grow. So again, as you stated brilliantly, that the bleeds on the pill are a withdrawal bleed. The bleeds without the pill are a bleed of a level 10 versus a level 1 or 2. And either way, it's not about toxins being flushed out. You really don't need to bleed every single month if you're on a hormonal method. If you're not on a hormonal method, then go see a doctor and get worked up for PCOS, pregnancy, eating disorder, tumor, thyroid, all sorts of things as a doctor that I should be checking for if you're not on any hormone therapy and you're missing 3 periods in a row.
Right, yeah, very serious issue nowadays. Okay, another thing that I've also heard, like that's a myth that we bust here, is that birth control doesn't make you gain weight, but so many people believe that, and I also did too. I mean, can't say an outlier, right? But typically, you have a very good statistic on this that you usually say. Would you like to share it?
Yes. So the research shows, again, if you have 100 women on the pill, 100 women not on the pill, the 100 women not on the pill will weigh a pound more. And you're like, what? And they weigh a pound more because they're bloating up and down, up and down. And so on average, they weigh a pound more because some of them are bloating up. And then this group is just, and then drop, and then, and drop. So no up and down, bloaty, bloaty. However, again, each person's different, and some pills, some progesterones give you more munchies than others. If I give 2 women the same progesterone, one will get the munchies, one will have no effect whatsoever.
Right.
And so if you notice after being on the pill for 2 months, you got a ton of munchies or you gained weight, then tell your doctor what progesterone you're on and try a different progesterone. Or it simply could be level of progesterone. You're on this level of progesterone. If we go down, then you will lose weight. But like I have a cousin, and whatever pill you put her on, she loses weight. And I was like, that's not a known side effect of any of the pills but that's the way her body reacts to it.
Right.
And each person is different. But the research shows on average, the pill does not make you gain weight. Certainly, what people will notice, and this is part of it, is over time, people on the pill gain weight. But over time, everyone gains weight in the
Yeah.
United States. We're not supposed to gain weight after like 20, 25 years old. We're supposed to maintain our weight. So if you want to be optimal healthy, you should not gain any weight after 25, unless it's muscle. That's fine. But if it's not muscle, then it's not fine. But in the US, we're all growing every single year, which we should not. We should not.
Yeah.
And so the weight gain is like the freshman 15. The weight gain is all those desserts that we ate or all the French fries. And I'm thinking just all the summer festivals and like stuff. So lots of food, cupcakes and boba and Starbucks and lemonade
Yes.
out
I
there.
know. So crazy. Just a little personal story. I didn't realize, I think because it's a very common thing nowadays, with all like mukbangs and like all these like glorification of food, that we realize we should not be eating that much. I think it's a very normalized thing with social media now to drive to 3 different fast food locations, get all 3 items, and then, consume that. But it's very different when you realize how much you're exactly eating a day, and if that really fuels your soul, makes you feel good. Glad you brought that topic up. Maybe it can be a topic for a different time, birth control, weight, something like that. We are almost at time's up. So if there's any questions at all, please drop them in the chat, and then Dr. Sophia Yen will answer them. If not, I just have a closing question for Dr. Sophia Yen. Because you're a birth control specialist, and you've been also on the birth control pill for, I think you said 14 years now.
At
So
least
what is your favorite aspect of the birth control pill that you like to tell others?
number one is periods optional, because knowing when you don't have to make periods optional on the birth control pill, patch, or ring. You at least can make it regular, because you decide when this placebo week happens. And it can happen every month, it can happen every 2 months, it can happen every 3 months, 6 months, or never. Again, some people like to have breakthrough bleeding every 3 months, so they just schedule it every 3 months if you're in that kind of situation. But I like the control freak in me likes to be like, oh, I have a test next week, so I'm just gonna bleed now so that there's no chance of me bleeding next week. So you can do that. Or I'm going to Italy and I don't want to bleed while I'm in Italy, so I'm just gonna go straight into my next pack of pills and not bleed,
Okay.
and so I like that. And then the other one is when I was younger, I would get one giant zit every single month. And it was the North Star here, here, here. It was just like gross, disgusting. Not only was I having my period, but then I got a zit too. And once I went on the birth control, no more zit, no more zits.
Right. Amazing work. I'll also share my favorite part about birth control pills. You actually stole mine. My number one reason was making periods optional, actually. It's a great fact that I tell everyone on it. The fact that you can, oh, hey, I have a beach day coming up. I think my period's gonna come. Let me just skip that. That's actually so incredible, the fact that you're able to do that. I won't copy your answer though, so I will come up with my second. My second is that it gives women power to really family plan and take control of their futures and academic lives. I think that now that we're in a place in our society that's very like normalized now, I think it's a forgotten fact of like even 30, 40 years ago, it was very uncommon for a woman to really take control of that path and family planning, career plan. But now that we're on it and it's become decently normalized, women can really take control of their own destiny. I think that's something so amazing for women's health.
As I like to summarize that is, you would literally have to be a saint, no sex, to get to become a doctor, a lawyer, anybody with a PhD, to get through college. Like, how could you not have sex in college? I mean, you can, and good job, all those that can pull it off. But the fact that we have birth control, preventing unplanned pregnancy, allowing women to go to higher education, because we know that 60% of high school seniors have heterosexual sex. And so somebody's going to get pregnant there if we don't have birth control.
Yeah.
And certainly can be the condom, but it's the condom is not as good as the hormonal options out there.
Yes, I agree. All right. Thank you, everyone, so much for joining us today. Again, thank you so much for our esteemed Dr. Sophia Yen for joining us on this TMI Talks. And we'll catch you for the next one. Be on the lookout for the next one, okay? Bye.
Thank you.